Learn how to tape the collateral ligaments of your fingers on today's episode. Coming right up. Welcome everyone to Focus Physio Climbing and Project Physio. I am very happy to see you here. I hope you get lots of helpful information from these videos. My name is Burke Salpst and I'm a PT here in Bend, Oregon at Focus Physical Therapy. Our clinic loves climbing, we love treating climbers, and this is a passion project of ours to bring you this information. So I hope you get a lot out of it. So it's Tuesday, and even though this is our first episode, that means one thing. It's Taping Tuesday. So we're going to look at a simple taping that you can do for the collateral ligaments of your finger joints. First, a little anatomy. The collateral ligaments attach on both sides of each finger joint. They attach a little bit obliquely, which means that when our fingers are flexed and we have downward force on them, pressure, those ligaments are taut. They're taut at about 80 degrees or so of finger flexion, about like that. We have another set of accessory collateral ligaments which are taut in hyperextension, so that if you hyperextend your fingers, there's not going to be very much side-to-side movement. Right in the middle, however, when our fingers are extended, we do have some rotation in those joints, we have some play, and thinking about that functionally, to manipulate objects, to place our hand on different surfaces, it's helpful to have a little bit of slack. Because of the tension in these ligaments, it's no wonder that they're injured in climbers, and this is unfortunately one of those more common types of injuries that can happen. If you bend your fingers and you look across this line, you'll see, especially as you get towards the smaller fingers, that there's a little bit of an angulation there. And that angulation means that when you apply some downward force, that force is not only going directly downward, but it's also putting a little bit of an angle on those fingers. The middle finger is the most commonly injured finger. But the other fingers can sustain this injury as well. We're going to look at two types of injuries to these ligaments. The first is a classic sprain, and these are graded 1 through 3. 1 is a mild sprain or a mild tear of those fibers. 2 is going to be a more moderate tear, and 3 is a complete rupture. Okay, quick safety meeting. If you've had a severe injury to really any of the structures of your hand, especially the ligaments and tendons, and your finger joints are unstable, you have pain, you have limited motion, go see somebody about that. Go to your orthopedic group where you live, see a physio that's trained in sports and climbing in particular if you have one available, but seek help. Especially if you take care of young ones, if you take care of kids and they have a ligament injury. It's very common in the literature that ligament injuries in particular are underestimated. So especially when it's a child, there is a growth plate in the finger joint involved with a ligament injury, so seek professional help. So that brings us to today's sponsor. This is a new channel, but we already have a sponsor. I'm very excited to share the sponsor with you, and the sponsor is, drumroll, Science. That's right. This episode and every episode we do is going to be sponsored by Science, and Science is going to bring us some great research articles that are going to help us understand exactly what's happening with injuries, exactly what's happening with our bodies better. Science, because seriously, it's 2020. We need science, otherwise we're pretty much just guessing. So Science, here we go. So today's article comes from the Journal of Prolotherapy, and it's titled Ligament Injury and Healing, an Overview of Current Clinical Concepts. As an overview article, this is basically just going to give us some fundamental knowledge and understanding of how ligaments are formed, what their structure is, their composition, what happens when they're injured, and so on. So a couple of key takeaways from this, and I'm going to include a link to this article, the reference for it in the description below. So be sure and look it up if you want to read it for yourself, and I recommend that you do. So here are our key takeaways. Ligaments heal through 3 distinct stages. The first is the acute inflammatory stage. The second is called the proliferative or regenerative phase. And the third is called the tissue remodeling phase. From the first moments after an injury until the end of the tissue remodeling phase, when that tissue is more or less back to normal, can take months, even years, and sometimes for ligaments. They don't have a very great blood supply, and they're limited in how quickly they can transform, but they can transform. During the proliferative phase, growth factor is what stimulates the synthesis of new collagen and the conversion of immature collagen to more strong, mature collagen. In the early days, when that new collagen is formed, it's shaped abnormally and the fibers are smaller in diameter than regular healthy collagen. This is something that needs to change before you're going to really be able to load your finger joints normally for yourself when you're climbing. And it's important that you are able to do that in order to get back to the wall safely without re-injury. During that tissue remodeling phase, that third phase, that's where this conversion is happening. Those tissues, those collagen fibers are getting thicker. They're looking a little more normal. However, this is something important to keep in mind. Injuries to ligaments after they have healed, those injury sites bear many resemblances to scar tissue. So even though they have healed, they don't look the same and they may never quite look the same. Although over many cycles of breakdown and synthesis, which is what happens under normal usage conditions, that tissue can function more normally. Just like you might have a scar on your skin. When you had that scar in its early stage, maybe it was stiff, maybe it was painful, but as time has gone on, that scar tissue becomes functional for you, even though it never looks the same. So ultimately, this is our goal for ligament recovery, is we want a functional scar. We want that ligament site to heal in a way that allows you to accept force through that ligament without compromising its integrity. Update on strategies to facilitate ligament healing. There have been updates to how we do things. So if people are following an old playbook, and some things that might have been in the old playbook would be things like anti-inflammatories, steroid injections. The new science is basically showing that those things will actually delay the healing of ligaments and the proper synthesis of that good, healthy, strong collagen. So we want to push those aside. That's a little bit of a look back in time, that history of where we've come from. And now the new model has to do with the appropriate load for the stage of healing and getting good blood flow to those tissues and using motion, the powerful remodeling effects of movement. So that's it for our quick article summary. Let me know in the comment section below if you found that helpful. I'm looking forward to bringing a new article to you each and every time we do a video. So stay tuned for more good science coming. Now on to the taping. This particular taping is super simple. It's been around for a long time. It comes from the athletic training world. And basically what we're going to do is we're going to make an anchor of tape on both sides of the joint that we want to stabilize. And then we're going to cross that joint 2 times or more depending upon the severity of the injury. So let me show you how we're going to do that. Okay, we got my trusty tape here. In the earlier stages of this tissue healing, it's not a good idea to just tape yourself and go for it. There are things that are happening physiologically in those tissues that make them vulnerable to injury even with tape. Tape is not a miracle cure. It's not going to save you if those tissues are just not strong enough to handle that kind of load. So you need to use a little bit of judgment and a little bit of wisdom here for when it's safe to start doing that. I've got this split out small strips here, and I'm going to anchor this right on my middle phalanx. Okay, so we're right there on the middle phalanx. I typically will go around 1 full revolution and then I'll do my crisscross pattern. Okay, the tape's pretty strong, and the little fingers are small fingers, so I really don't find I need to anchor much more than that. So at this point, this is the side of ligament that I've injured. So as I come around, I'm basically going to cross that joint line just like that, and then put another full wrap, and then cross back. So I've made a little X right on the side of my finger. If your injury was to the inside, then you would do the same thing. You'd come around and your X would basically be right there on the inside, like so, okay? If you have a problem with the extensor mechanism on the top, you're going to do the exact same thing, only now we're going to cross over the top of that joint, hit our wrap, cross over the top, and so on. For climbing, this ligament is taught in flexion, as we talked about, but it's a little hard to really get the tape on when my finger's that flexed. So I'm going to only have a little bit of moderate flexion in there, like so. And then we'll hit our tape around. Here's our flexion, and there we go. And when you get to the end, I just use my teeth, smooth that out, and ideally I try to end it away from the surface that's going to be on the holds on the rock so that it doesn't peel when I'm on a route. Okay, so there you have it. There's the inside, minimal tape. Here's the outside, extra support. I've got it taped in a little bit of flexion. As soon as I start to put a little bit of load through that, that tape is going to just give that ligament a little bit of extra support. I hope you found this video helpful. Thank you so much for joining me. Smash that subscribe button. Stay tuned for more fun and informative videos to come, and we'll see you next time.